evening and good to have you with us in this edition of the Urban Debate. We put the spotlight on India's vaccination policy and the vaccination drive. And frankly, right now, there are way too many questions than answers that we have for our viewers. But we're going to look at piece by piece and start off with what the Supreme Court said. Before that, let me tell you what happened today when the Supreme Court bench took up the COVID case hearing. The case that the Supreme Court itself took suo motu cognizance of and decided to talk about. It started off by saying, at the outset, we want to make it extremely clear that you cannot be harassing people for sharing their grievances on social media or the internet. The judges there making it very, very clear that there cannot be any action against a person who is sending out an SOS or a grievance, whether it's on social media or anywhere else on the internet. It cannot be taken as wrong information. They cannot be booked. And if there are any instances of harassment that the Supreme Court finds, then it will be contempt of court. This is a much needed breather coming in from the Supreme Court. We've seen reports emerge from multiple places of how people, even hospitals who took to social media, were clamped down by the government. In Uttar Pradesh, there was an example from Amethi, where a man whose grandfather was ill put out an SOS for oxygen. He lost his grandfather. Later on, the authorities claimed that his grandfather didn't have COVID, and he was booked for giving false information. But this is the Supreme Court standing by the right of every Indian in times of a pandemic, of a COVID catastrophe, the kinds we have never seen in our country, standing by us to say you have the right to voice your grievance and nobody should be able to harass you for that. Now, let's also tell you the various questions and issues raised by the Supreme Court. And if you've been tracking our conversations, our debates, you will see, viewers, many of these issues, many of these points were even raised by us in our conversations, either with the political representatives or with the experts. On the vaccination policy, there were some very, very crucial questions that were asked. The Supreme Court said different prices don't make sense. Why should we as a nation pay this amount? The Supreme Court even raised the issue of higher prices in our country for the same vaccine which is being sold at a much lower price in European Union or even United States. Then, apart from talking about the high prices of vaccine in our country, they even asked the government and to introspect, to think about whether this policy is sound, the policy of having the states pay a different price than the price that the center is paying. The differential pricing, which is the first issue that we here on Mirror Now raise, is to say whether this really makes sense. Why should we be paying so much? Rules mandate center to control drugs prices. Vaccine pricing is extremely important. We believe there should be a national immunization policy. The Supreme Court of the view that perhaps it would be better if the center procures the vaccines nationally and let the states have the responsibility of distributing them and vaccinating the people. So let's talk about the vaccination policy. And I want to highlight that there is no final order by the Supreme Court right now. That will only come out tomorrow. They're in the process of writing it, obviously, because this deals with a very, very serious issue. It needs a lot of deliberation. It's also connected to the government policy, so the courts have to think about what it is that they can do over here. We will also, over the next 1 hour, talk about tomorrow and what may or may not happen tomorrow. With over a dozen states postponing the vaccination drive, 2 states saying they will partially start the vaccination drive for the people above the age of 18, and 1 private hospital chain announcing that they will be vaccinating people because they have managed to buy these vaccines directly from the manufacturer. In a country where over a dozen states don't even have an idea when they will get their vaccines. In a country where half of the vaccination centers don't have any stocks. Here is an example where one private hospital will begin its vaccination tomorrow in their own centers. I say good evening to the first set of panelists who are joining us right now. Deshrat Nigam, advocate of the Supreme Court; Pallavi Sharma, spokesperson for the Congress Party; Dr. Rajiv Das Gupta, chairperson for the Center of Social Medicine and Community Health at JNU; and Mr. Pallav Sishodia, senior advocate of the Supreme Court of India. Mr. Sishodia, let's start off with you on the what we heard in the Supreme Court. What are your own thoughts? Would it be better to have a policy at least where centrally we are sourcing all the vaccines and then allocating and distributing them basis the need?
You see, I would agree that we must have, like all other Western countries, a system in which the government is administering it to everyone free of cost, whether that person is a millionaire, a billionaire, or a poor person. Because once you introduce a system of pricing, the priorities get distorted. And this is what you have just now mentioned, that a private hospital is able to administer vaccination, whereas the state governments just do not have the vaccines available. And this is because of this policy which perhaps need to be better thought out and implemented uniformly throughout the country for every citizen.
Okay, so you do believe that there needs to be some amount of centralization as far as the procurement is concerned. Let me also bring in Mr. Deshratan Nigam on this. Mr. Nigam, we are right now, looking at a huge controversy over the fact that most of the states don't have vaccines. But one private hospital does. The central stock is also running low. There are thousands of people who don't know whether tomorrow they will get a slot or not. Should they go? Should they not go? There is absolute confusion everywhere. Is this the kind of vaccine policy that we had envisioned? Mr. Nigam, you're on mute. You'll have to unmute yourself.
Yes, I have unmuted myself. Tanvi, in fact, I stay in NCR in Ghaziabad, just next to Delhi, where the private hospitals did not have the vaccines, but the state government has it, and the state government is doing it daily. I got my friend's parents who stays in USA, and they were not getting their second shot, and I got them vaccinated near my house in a primary health center of the state government, where they were, vaccinating. So the issue right now is ramping up production. The production got a little bit of jolt because of the ban on the raw material from the US, which has been uplifted now. And the policy has to be to ramp up production. And Bharat Biotech has taken the decision to diversify its production, and they have identified other producers as well, and they are trying to upgrade their production level. So right now the policy should be to manufacture as many vaccine as possible. And secondly, national immunization program, as the Supreme Court said, works perfectly fine in normal circumstances, because when there are normal situations, and it works very slowly through the apparatuses of the state government. Now, Supreme Court is not an expert body on medicine, and there is an expert group, and I am sure central government will come back to the Supreme Court and tell them these are suggestions that have come out. Now, when you centralize distribution, and the center comes up between the company and the states, you increase the supply chain. And here, what I like about Supreme Court is that centers should obviously fix the quota, and that quota should be lifted directly by the states from the companies. So centers' role for supplying should be eliminated. What Supreme Court suggested is that there should be centralization of procurement. Yes, I agree, but the distribution has to be straight away from the companies so that one level of supply chain is reduced and the delay can be
Okay,
cut
so
down.
very interesting that you say that, Mr. Nigam, because that's exactly the point that I am also asking and making here. And just to clarify, what you're talking about up till now, whether private hospitals have it or state centers have it, is a very different thing. Up till today, everybody was getting it from the center quota. Everyone. Starting tomorrow, the states and the private hospitals are on their own. The central quota will be via central vaccination centers for those above the age of 45. So now the states have to fight for the same quota at a lower price as the same as private hospitals. A private hospital can give an order for doses at the price of 1200 rupees per dose for Covaxin, whereas a state government's price there is 400. And it is up to the vaccine manufacturer to decide who they give it to. So when you say that you are in agreement with the Supreme Court that this allocation should be done by center, right? Not just for the center's quota, but even for the rest of the 50%.
Yes, what I am saying is the Supreme Court what has said that procurement should be centralized and central government should procure and then take it and then distribute. There I don't agree. The court let the central government fix the quota and that should be directly lifted by the state government from the company, so that supply chain does not get elongated. Secondly, about pricing, I think the exact pricing about the Western countries that Supreme Court talked about was not very clear, because I clearly read just now that the CFO of Pfizer, which is D'Amelio, has clearly said that they are giving the vaccine in USA at the rate of $19.50 US dollars. And in fact, what they are saying, after this pandemic is over, normally what they charge is $150 to $175 per vaccine. So there it is still costlier. I think that facts will be brought by the center to the US government. Yes, center must subsidize, and later, that amount can be adjusted from the GST allocation to the states afterwards when you are taken care of the pandemic, because your financial pool is limited. Therefore, at this stage, the center can come into play and subsidize all this. And again, I'm saying, let us not elongate the supply chain and let the role of center, because we are in a federal structure. States have to also perform their responsibilities.
No, so okay, fair enough. You are so. Correct. So, correct, you're absolutely right. But Mr. Nigam, it doesn't elongate the supply chain. It's not to say that even right now, the vaccines are going from the, plant in Pune to some central place, and from there going to a state place. They're any which is being directly supplied. It's just that the allocation and the payment is being done centrally, and the pricing had been decided centrally, because the central government was in conversation with the manufacturers. Let me bring in another panelist as well. Dr. Rajiv Dasgupta, to you first before I go to Pallavi. Again in the court today, in the Supreme Court, and I want to highlight this part, pricing, procurement and distribution all were discussed, where the Supreme Court justices said, shouldn't leave pricing and distribution to manufacturers. You should take responsibility for pricing and distribution. Procurement ultimately meant for citizens. Why not adopt, of course, a national immunization program? Why can't center acquire all and then distribute? Similarly, on pricing, the Supreme Court said, can the question of equity, a very, very important part, be left to the private sector? 4,500 crore funded for making vaccines, so we also own the product. The same manufacturer is charging you 150 rupees and 300 to 400 rupees to the states. Why must nation pay this? Why can't the center get in bulk and give it to the states? Your view on this, do you believe the center needs to relook at this latest policy decision?
Okay, let me set aside my beliefs for a moment. Let me just clarify a few of the basic rules of the game. First is that what has been driving the central argument in the Supreme Court's consideration. These are two. One is vaccine equity, which is for all, and the second is health security, because it is not meant to protect an individual, but meant to protect the population in order to be able to slow down the pandemic as a whole, both at the national level and contribute to the global slowdown. Now, the case where an individual buys a vaccine or an individual hospital buys a vaccine is when you are protecting the individual. For example, the case of a rabies vaccine, anti-rabies vaccine. There, an individual or a unit, such as a state government or a municipal body, buys the rabies vaccine and then inoculates it through its clinics. But those are very small in numbers, one. And second, those are meant to purely to protect certain individuals at risk, which is not the case here. Now, as far as the distribution system goes, let me just clarify what the system is. The system is for the universal immunization program, which is the bulk of the country's program. The center procures it. Please remember that if the factories have to directly distribute reach the consumers, it will get into the same mess that oxygen is today, with a handful of producers to distribute all across the country. It will be the same mess. So the way the national program operates, there are 4 central depots which are called GMSDs. From there, it flows to the state depots. Most states, particularly the larger states, have regional depots, and that's how it flows down to the district level. The critical thing in vaccine is also maintaining the cold chain. There are extremely rigorous temperature requirements, as we know. So this is how the vaccine flow is. It cannot be bought literally over the counter in any sizable quantity at the population level. We have to, this is not buying any other product off the shelf, because the population level massive inoculations are being done with 70,000 vaccination centers. We are talking of at least 70 up to 70 lakh vaccinations per day, which is currently at about 35 lakhs. So hopefully it will be able to double up. Now at that scale, you cannot have a one-to-one buying and selling. That's just inefficient and unsustainable.
But it is happening. For example, that is exactly the fallout of this policy decision, Dr. Rajiv Dasgupta. For example, the Apollo chain has managed to get themselves vaccines even before 80% of the state governments have. And they are starting their vaccination program tomorrow.
If every unit has to be, will place an order at SII Pune, you can imagine the time and labor they will be putting into making individual packs. It just doesn't work, vaccination programs of this scale. And that's why I gave the example of rabies. There's a distributor in, I'm saying this slightly lightheartedly, there's a distributor in North Delhi. You can buy almost any international childhood vaccine there for diseases which are not in the program. You can just as you can buy any brand of chocolate, you can buy any brand of vaccine, but that's for a handful of individuals, not for millions.
No, that is, of course, that's a different thing. Nobody is saying that I will be able to go and buy it, at the Serum Institute or even at a medicine shop. The policy that we are talking about, Dr. Rajiv Dasgupta, is, does it make sense to leave 50% to states and hospitals to directly have these conversations? The SC itself has done the math and said these many crore people still have to be vaccinated. You cannot leave it to a model that could lead to an unequal distribution of vaccines and at a higher price.
It's one thing to do a math, it's another thing to run a program efficiently. The math is correct. There is no problem about the math. How many vaccines are required and who will pay and what it will cost and so on. That's the math. That's the easier part. But in terms of vaccine equity and health security, I believe those are the principles that the Supreme Court has kept in mind.
Okay. I go across to Pallavi as well for her comments. Pallavi, as we said, there are 2 or 3 important issues that the Supreme Court raised today where they seem to be of the view they've not passed any orders, obviously because this is a very big government policy area as well, but they will come up with an order tomorrow and we'll have to wait and watch to see what it is. So these are all conversations and comments that were made during the hearing. But they are saying the same thing that we have raised many times about who has the control. Does the vaccine maker have the decision-making power, or should it be the government?
Good evening, Tanvi. I hope you, all the panelists and everybody watching this show is safe and healthy. Tanvi, if I'll say that the Congress party had long before said and raised these pertinent questions that why shouldn't the center procure all the vaccines, it'll sound as if I'm into some one man upmanship, but that is not what I'm trying to do. Let me quote Ms. Sujata Rao, who's the former secretary of family health and family welfare department of the government of India. She has said first time in 73 years she has seen that the central government have left the states to their own, and they're not following the national immunization program, and they're not following the national vaccination program policy. So I think what the Supreme Court has said today, these questions were long before in the public domain. Media houses like yourself, journalists like you were asking them, the Congress party, the opposition was asking them. The only problem was that it was meeting with deaf ears. The government was not willing to listen to the opposition party for whatever reasons. But today the truth is that the catastrophe that has befallen the nation, the pandemic that we are in, the crisis that we are in, we need to work hand in gloves, all of us together. The government must understand. And can I please, remind your viewers and remind all the panelists, Adar Poonawalla, who runs SSI, Serum Institute of India, was on record giving interview to a national channel, and he said that even at 150 rupees, in which they're selling the vaccine to the central government, they make enough profit. So why sell it at 400 rupees to the states and then reduce it to 300 rupees? So, at times like this, we need people like him, institutes that have been funded by the government. The Supreme Court categorically mentioned today that around 1,500 crores were funded to Bharat Biotech and around 3,000 crores to Serum Institute of India, 4,500 crores altogether. So why can't the people get these vaccines for free? Why can't the central government procure those vaccines and then allow the states to go ahead and do the distribution? Now, Mr. Deshratan Nigam was making a point, and I was unfortunately having some problem understanding him, the point that he was trying to make. He was saying that the central government should fix a quota, and on what basis will that quota be decided? On where the BJP government is in power, and in that states will get more priority, and where it's not in power, those states will be left on their own. So I think this quota system and everything should not be things should not be complicated any more than they are now. It should be a very simple program that the Supreme Court has said, in the Congress party.
Then how do you decide who gets how many vaccines?
So why can't it be decided based on the population of the states? Hasn't the Supreme Court asked for the exact data of population as to the number of people between the age group of 18 to 45 years? There are 11 states today who've categorically come on record and said that we can't open vaccination for people aged 18 plus because we do not have vaccines. Now, whatever this government did in the past, it exported twice the quantity of oxygen. It exported vaccines in large numbers, leaving its own country, in hindsight. Let us not question all that today. The country has witnessed it. The country will not forget it. But today what we need to do is come up with solutions. And what Supreme Court is saying is exactly the need of the hour. The center government should procure vaccines and let the states carry on distribution. The states can then decide. Many of the states might even come forward and say that, with the 50% quota, we can give free vaccine to some people in the states. Like the Chhattisgarh Chief Minister had announced, unfortunately, they don't have enough vaccines. So let the central government do the procurement.
Well, most states have announced free vaccines. The irony of the situation right now, Pallavi, is that most states have announced. I don't know of any state that's not really, maybe a couple of them who've not announced free vaccines. So the ironical part is they don't have the vaccines. When they do, their intention is to give it for free to people. Of course, people may choose to go to a private center, at which point they can pay the price that any private hospital is going to be charging them. But if I can just go back to Mr. Pallav Shishodia. Mr. Shishodia, Pallavi is right in one sense that there is no point now in having a conversation about what we could have done or what the policy should have been. It now needs to be about how do we course correct. I am looking at some of the data, a lot more perhaps the government will give tomorrow in the court, but as we speak, even the central's pipeline isn't very strong. As we speak, they have got about 16 crore vaccine doses, of which they have already, they have given 16 crore doses to the states, of which the states have already consumed 15.1 crore. So each of them only have left for a few days. The vaccines in the pipeline, even for states and UTs to be supplied via the center, are just about 1 crore more. So there is a lot of pressure on one side already. Now we are looking at the second part where we are talking about opening up, but we don't know how it will function and we have no clue what's going to happen on ground tomorrow. How do we now tackle this situation, this vaccination drive from here on? What can be fixed?
Tanvi, you see, I'm not an expert on vaccination or immunization, but there are a few fundamental things which can be talked about. Number one, that, this government in our country or any government in the world, they are not used to tackling a pandemic of this kind. This is a century, once in a century kind of an event. So we have to grant certain trial and error to the governments, whichever government in whichever country is tackling the pandemic. Now, having said that, there are some fundamentals. Number one, the pricing also has two levels. So one level is the price which a manufacturer should get. Now, in America, the Pfizer, etc., are getting maybe $100, $150, whatever. But the recipient of the vaccine doesn't have to pay. Now, this is very important because AstraZeneca is selling the vaccine in European countries and even in America also for $2-3, whereas here the price is much more in that sense. But all these comparisons are not really would not take us anywhere because there are so many things which go in pricing. There are commercial considerations, the value of patents, the people who have worked and invented a medicine or a vaccine, they have incurred enormous cost of research development. So everybody must be compensated. The point is, as one of our panelists said, that when you talk of the vaccine equity, it is the population which has to be vaccinated. It is not you or me. It's not that, see, I'm one of the lucky ones who have got both the vaccines. But I cannot dare to move around freely. I cannot dare to meet people even in my house very freely because I can't have visitors. Because unless the entire population around you is vaccinated, nobody is safe. And that is where the role of the state comes. The role of the state is to ensure that vaccines are given to the extent available on a certain priority basis. It's very easy to announce that everybody above 18 will get it, and then you don't have any vaccine. And then you have these distortions where the private hospitals, which are selling it for, say, $1,200 or $1,500, which some people can afford, and they go there and get vaccinated. And then this creates enormous amount of social unrest. Plus, it doesn't serve the purpose because you have only very few people vaccinated and the large population roaming around without vaccination. So therefore, and see, so far it worked. We were all able to have the vaccines very easily. But when you expand the basis or the mass of population which would now come in the second round of vaccination, it can't go in the way it has been going on. And the government must look into it. There's nothing wrong in having a course correction and having a real look at everything so that there's a vaccine equity which is maintained, which is very important for the entire idea of vaccination. These can't be the individual one-upmanship or somebody getting it and lot of people not getting it. So that is the fundamental thing which has to be kept in
Yeah.
mind. And there is a need for a relook.
And so let me just ask you a very quick follow-up on that then, Mr. Shishodia. Do you believe that this is something that the court could look at and ask the government to do?
Certainly, you see,
and I'm not asking to preempt what the Supreme Court says. I'm generally trying to ask, because there's often a debate between what the elected governments and executives should be doing and what the judiciary's role is. But in times of an unprecedented pandemic, where does the judiciary's role lie?
You see, there's always a debate between what you call an active judiciary and a judicial restraint. There is always a debate about the executive power of executive, which is elected, and we have a duly elected democratic government in our country. There's no doubt about it. But then there are so many gray areas, and there are issues and issues. So today, if there is a question about having a border conflict with China, certainly the courts do not have any role. But today, this pandemic has put in question the right to life of a citizen, which is guaranteed under Article 21. And the Supreme Court has a jurisdiction under Article 32 of the Constitution to protect the right of life. And you have an entire line of cases on environment where the Supreme Court has stopped mining, taken over the minds of people, taken over the industries, stopped the industries. They have created a Campa fund in which thousands of crores are collected for reforestation, etc. So there is no doubt that the Supreme Court has a power,
Right.
and it is not always hostile to government. Let's be very clear. We are not here to have a blame game. We are not here to blame the government, because government, like all other governments, it's on a trial error mode, because there are no precedents available to it. There's no past of these pandemics which is there to guide us. So the courts can definitely come to the aid and put focus on certain areas which may in a normal course get omitted by the executive, and it should not be taken as a role
Okay,
as a kind of
fair
a fight
enough.
between executive and judiciary. It's a complementary role to each other, and both institutions can contribute in their own way.
Okay, fair enough. Pallavi wanted to make a point. Go ahead, please.
Thank you, Tanvi. Just 2 quick points. First, Pallav sir was speaking about the pricing, and that how there are a lot of stakeholders that are involved in the process when a vaccine is developed, and all of them need to be compensated. So the pricing of the vaccine depends on that. I will reiterate what I said. The SII, Serum Institute of India's chairperson Adar Poonawalla, is on record. He has given a full-fledged interview saying that even selling the vaccine at 150 rupees incurs huge profit for them, and they sell the vaccine at 150 rupees to the central government. The only question here is that why are they selling it at double the price to the state governments? Why can't the central government procure those vaccines? It has funded those institutes, it has funded Bharat Biotech, it has funded SII. Why can't it now procure those vaccines from them and then allow the states to carry on distribution? The second point, Tanvi, one quick point I'd like to make is about blaming the government that he was saying. I agree. If the government was doing its job properly, the Supreme Court would not have stepped in and taken suo motu cognizance. And this is a democracy. Let's not, like every situation when there are fingers pointed at the government, you have the government stepping forward and saying, this is not the time to blame, this is not the time to point fingers, this is not the time to ask questions. I think we at this stage, at least when we are seeing lives being lost so tremendously, like they're being lost, it's heart-wrenching. Every time you'll see requests being made for beds, for oxygen cylinders, and now it has gone to the extent, Tanvi, let me tell you very categorically, where requests are being made for cremations, for slots in the crematoriums. There are no slots available in crematoriums. A very leading journalist of this country tweeted yesterday that he received a call at 6 a.m. in the morning requesting him to find a slot in a crematorium, and when he tried to pursue that request further, he found out that for at least 2 days all the crematoriums in South Delhi, in a place like South Delhi, which is quite a privileged place, all the crematoriums were full. We are seeing people dying on the roads. If we will not blame the government
no,
now,
so Pallavi, I think there is no denying the fact that even that governance has stumbled and failed. There is no denying the fact. The reason that you've had 11 high courts take up this issue and ask question after question, look into the matter directly, shows you that the reason why the Delhi High Court is holding hearings every day on oxygen shows you, because you know it more than I do of what's going on in the national capital as far as the oxygen situation is concerned. Even now, the fact that the Supreme Court had to come into this and is now asking a series of questions, and I want to highlight this because the Supreme Court came with many questions on vaccination, on pricing, on hospital admission policy. They had very, very direct questions on what is the hospital admission policy that we are following, and it is important because often we are seeing right now that people are being denied admission when they're in an extremely serious condition because of the either the system that's been put into place or because there is no accountability or regulation. So the Supreme Court has gotten into those things, and like Mr. Pallav Sishodia was saying, and in such unprecedented times, the courts can always come to the aid of the governments. There is no denying the fact that the government has stumbled and failed on many aspects. We could have said that it's all new to us a year ago, but after the first wave, if we hadn't learned our lessons and if we haven't prepared ourselves for a stronger second wave, that is on these governments, state and center as well. Mr. Rajiv Dasgupta, you wanted to make a point?
Pallavi, I also need.
No, the point is that taking the supply situation into account, there has to be a realistic calculation of how much can be vaccinated, and therefore whether everybody above 18 can actually be vaccinated. The answer seems to be no. But then a realistic calculation and message has to go out that this is a more plausible schedule rather than registering everybody and then the state and the center has gone into in a situation of conflict, denial, whatever you call it, that there aren't available vaccines. This is just not good public health communication and practice. This causes a whole lot of confusion on the ground, and this is completely avoided.
Dr. Rajiv Dasgupta, I usually do admire you for your directness. Today I see you hesitating, but let me just put it straight, and you tell me if you disagree with me. We don't have enough vaccines, and right now I'm not getting into the merit of whether that could have helped or not helped. We don't. Even for the central government's quota, the stocks come down to just about 1 crore vaccines right now. We have gone from an average of 33 lakh vaccinations, 34 lakh vaccinations per day to an average last 7-day average of 21 lakh vaccinations per day. That's a 38% drop. Centers in Mumbai have now been shut for days together because they don't have the supplies. It is true, and the vaccine shortage is very, very real. For the life of me, I don't understand why, when this was so clear, did we decide to make the announcement of opening up to 18 plus. Let me also say good evening to Dr. Om Shrivastav, Director for Infectious Diseases at Jaslok Hospital, member of the Maharashtra Task Force, joining us right now. And Dr. Shrivastav, we are also now looking forward to what happens from tomorrow. Most states have said that they will not be able to start the phase 3, which is for all above the age of 18. Madhya Pradesh, Karnataka, Tamil Nadu, Delhi, Jharkhand, Kerala, Goa, West Bengal, Arunachal, they've all come out and said they can't. What is the situation for Maharashtra Has there been any indication? And when it does start, how will it really work out? Will it be at different centers, at the same centers? What happens?
So thank you for having me on the show, Tanvi. You're asking a very, very important question, but the answer is going to be very complex. I think that whatever it is that gets decided, it will impact only on one issue, and that is the rollout. So it's not just about the vials, as you say, how many vaccination centers, what kind of staffing, for how many hours are they going to be open, all the people who have registered, who are at the highest risk at that stage. All of these things are going to be deciding as to how successful the vaccination program is, and not just in Maharashtra, but in any other state. So I think that, before tomorrow is going to be the big day when it is going to be rolling out, yes. But after tomorrow, the subsequent days are going to decide as to how successful, how streamlined, how well it can be done. And then, of course, to my mind, I am not a public health specialist, I'm a clinician. But to my mind, the key is to set the target. How many people do you want to vaccinate? By what time? So you say, we are going to vaccinate, say 7 crore people before the end of August. That is how you plan out. You'll need to plan out how many centers you need, how many nurses you need, how long the centers are going to be open. And that is how you are going to be successful in implementing. Otherwise, you're simply chasing the curve. The curve is going to be ahead of you. So I feel that, all the planning that has gone in so far, it needs to be implemented on a war footing with clinical precision before you can say that, yes, it's a successful program or a failure. Or when I say a failure, it just means that you have to revise.
So let me ask you this question. You are absolutely right. And you say we need to proceed with clinical precision. Yes. So Dr. Om Shrivastav, does that mean that, state-wise, we need to be looking at a more targeted vaccination policy to go in with the worst hit districts, the worst hit zones first, because obviously the supply is limited. So we any which ways can't give it to everybody right away.
Not just the worst hit districts, Tanvi, but also in the worst hit districts, the people at the highest risks, the people who are the super spreaders, the people who are most likely to be heading to a hospital for a number of reasons, whether it is the lack of medical care or it is just simply lack of awareness or lack of infrastructure. Those red spots and those populations in that red spots need to be vaccinated first, and that needs to be first streamlined, and then you go on to the next lot, and then the next lot, and the next lot after that.
Pallavi, can I?
Okay, let me also say.
I comment?
Yes, go ahead,
comment
please.
Tanvi, one thing is, there are a few issues which has come up that, yes, high courts are discussing, but they are discussing governance or misgovernance of their respective states. So that thing is very clear. And Supreme Court has the jurisdiction to discuss about center's role as well, which they have rightly gone into. Now, second, about pricing. See, as long as Serum Institute's raw material pricing that was available at that point of time, one could understand about the profit. But in the absence of the pricing of the raw material right now, I think we are unable to question the pricing as of this stage. We have to know after the ban, what is the pricing of the raw material which is coming in now. So at this stage, we cannot comment on pricing. Yes, as I have said, Government of India and the state governments must subsidize it. Even if the pricing because of the raw material is higher, then this can be worked out at a later stage. Right now, the effect is, and the purpose and objective is to vaccinate as many number of people as possible. The entire issue boils down to ramping up of production, because this is vaccine is in short supply. So production has to be ramped up at any way, whichever way is possible, and that will ease the entire situation.
Okay, let me also say good evening to Dr. Dileep Mavalankar, Director for the Indian Institute of Public Health and a member of the COVID-19 Task Force in Gujarat. Now, Dr. Mavalankar, what is interesting is that while there are about 12 to 18 states who've said they will not be able to start vaccination tomorrow because the vaccine manufacturers have told them the supply will only happen by mid-May. We understand that Gujarat is one state where you are going to get 3 lakh vaccine doses from the vaccine manufacturer today itself, and you will start off the program tomorrow. Is that correct?
Yeah, I think that is what I have also heard, but the main supplies will come in the middle of the month of May. So we may start tomorrow, but the rapid scale up, which is 1.5 crore doses which are ordered through the 2 suppliers, will come by middle of the May. That's what I understand. But tomorrow there would be a beginning made.
So how do you see this working out, Dr. Dileep? Because, you know, with very limited doses, if you open it up, it's just going to lead to a lot of confusion to people who keep trying for slots, don't get slots. Most of them may actually just turn up at the centers. Majority of our country is not really tech savvy to be checking for slots on their apps.
Yeah, so as of now, you cannot or should not be going to the center if you are under 45 and don't have an appointment. So under 45, my understanding is only by appointment. Above 45, which is the national free vaccine, you can go probably without appointment and do local registration. So in some sense, there will be some confusion, but at least we are moving forward given the situation. Of course, supply constraints are there, which are very, very clear given the total capacity, as everybody mentioned. So unless we ramp up the supply very much and do rapid import of whatever other vaccines are available, we may not be able to ramp up the total vaccination. The other thing is, I had been suggesting for last 2 months, focus on the districts which have the maximum number of cases, which somehow is not well understood. So the objective should be reaching herd immunity in those districts where maximum cases, and there are only 50 or 60 districts in the whole of the country where maximum cases and deaths are happening. And that's where the vaccination should have been opened above 18, maybe since February, not now. So my views somewhat are different than what is being currently done. We are currently protecting the vulnerable, but not hitting at the transmission chain through the vaccination mechanism.
Dr. Shrivastav, do you want to comment on this, of the way to go, for, how to go about it?
Yeah, look, I would reiterate the point that was just being made. You need to make sure that the ones who are the most likely to be spreading the infection are the ones who get the first dose and the second dose at the earliest possible time. But for that, the machinery of, forget about a state, the machinery of a district as well will need to be so much prepared, so ready with the numbers that they have, with the resources that they have, that it has to go on as on a war footing, really. I can't think of any other term to describe this, because, we are actually looking at the vaccination program putting a halt or at least arresting the kind of numbers in the third wave. So we are nowhere close to understanding what is going to be happening with COVID by the time it comes to, say, September of this year or December of this year, or even sometime in the middle of next year. I think that vaccination programs in the most important parts of the country need to be identified. The most vulnerable people need to be identified, and the vaccine need to be given to them. To my mind, I know it's a simplistic statement, but it is really as simple as that.
Okay, my final question to Dr. Rajiv Dasgupta, who's with us, before I wrap this up. Dr. Dasgupta, how do you envision this working out on ground? You have the central government centers which will only vaccinate people above the age of 45. You have the state government centers who will begin to function essentially when they get their vaccine at 300 rupees or 400 rupees or free if the state has decided for free. And then you have the private hospitals who will charge you 600 or 1200 per dose when they get it from the manufacturers. So many different prices and multiple centers. is this really the best, efficient way to go forward?
Well, on a lighter note, it's a game theorist's delight. Okay, it's actually a game theory problem on one hand. But just to sort things, and this is probably what the Supreme Court is going to consider tomorrow, as far as production is concerned, that's the center's domain. How to increase the production, whether to invoke compulsory licensing, whether to import, and so on and so forth, purely a central domain. Pricing, it just doesn't make sense to have 3 or 4 different kinds of prices for the same product in the country. That's where, again, the center's role is very strong. Distribution, the chain, as I explained, exists from the center to the periphery. It's really what other specialists have been talking about is really the prioritization strategy, whether it's in terms of population groups, whether in terms of geographies, or whatever element of vulnerability each state or district actually wants really to focus upon. That really is that operational bit is in the states and districts domain. And I think these various functions need to be sorted out, and perhaps we will have rethink on this, everyone acting together, and I'm sure many of these issues would be sorted out. Programs are built brick by brick. This one would be no exception.
All right, completely out of time. I'm going to thank all of the panelists. Pallavi, sorry, ran out of time. Otherwise, would have come to you. But thank you to all of the panelists who joined us on this conversation. In case you're all still wondering, here is how things stand. Chhattisgarh, Arunachal, Tamil Nadu, Kerala, Karnataka, Jammu Kashmir, Rajasthan, Delhi, Punjab, Chandigarh, Madhya Pradesh, West Bengal, Goa and Uttarakhand will not be starting their vaccination drive for 18 above tomorrow. They don't have the stocks. Maharashtra may attempt to do some kind of a token vaccination program, but largely it's not for everybody. So don't have huge expectations even if you're in Maharashtra. Gujarat and Uttar Pradesh have announced, but like you heard from an expert from Gujarat as well, these are very, very limited stocks. So the real thing actually only begins by midway or 3rd week of May. What happens to the pricing and the overall procurement policy, what can be done to step it up, to step up the production, to ensure there is equitable distribution of vaccines to everybody in this country and those who need it the most. Perhaps we'll have some direction coming in from the Supreme Court tomorrow, and we'll keep you updated on that. Thank you so much for joining us.